promise every client that they will have a registered nurse actively involved in their overall care. And that, again, is a unique piece of what BrightStar provides, different from our competitors. So regardless of the type of care you receive, whether that's simple companion care or personal care, or certainly skilled care, that BrightStar registered nurse director of nursing is actively involved. How so? We come out as the registered nurse and do the initial evaluation. We call it a comprehensive health and wellness evaluation. So again, regardless of the type of care you receive, our registered nurse is going out to meet with the client to determine what their care needs are and determine what that plan of care should look like. And that's true across the board. Now, why would that be helpful or valuable to the consumer? Well, it's rare that a client has that kind of direct access to a registered nurse. That registered nurse can provide health counseling. That registered nurse can provide guidance to the family as to what steps may need to be taken next. Even though we're not perhaps doing advanced care for this client, perhaps they're just receiving companion care, we always do a fall safety evaluation. Why is that important? You know, what consumer with an older adult loved one who's seeking care isn't worried about falls? They all are. So BrightStar, as one of our brand standards, has the registered nurse conduct a fall safety evaluation. And then we can give you guidance as to what would be good opportunities to correct any of the potential findings that we discovered. So for example, you have throw rugs all over your home. And when you walk around, maybe your gait is no longer quite as brisk or robust as it once was. And your risk of falling is heightened because of those throw rugs. So we would advise that you get rid of those throw rugs, or you replace them with rugs that are much more secured to the flooring itself. And our caregivers understand it as well. Our caregivers even conduct a home safety evaluation almost every time they're in the home. They're very mindful of what is in and around the home that could contribute to a fall. But again, led by the registered nurse director of nursing, establishing that plan of care and guiding the family, the client themselves, and our BrightStar caregivers in what to do to keep the client as healthy as possible for as long as possible. And you just don't get that with other brands. One of the cool parts of our technology platform is that we're adding features and functions to do more mobile documentation, which has value in this regard. The caregivers will be able to check in and check out, so it encourages more accuracy around time and attendance. And that's important to the client who's paying for those services. You know, they want to know that their caregiver is arriving on time, staying the full time, and frankly also executing any important paperwork. That's really very relevant when it comes to long-term care insurance, paying for services. If the client has long-term care insurance coverage, there has to be certain specificity to the documentation, and that will be enhanced through BrightStar's mobile platform around time and attendance, but also documentation. So I'm very excited about that as we implement clinical documentation in the very near future that will help us have better, meaningful documentation related to not only reimbursement, but clinical outcomes. One of the things that gets me very excited is our ability to have better data around outcomes related to care. For example, our fall rate, or our medication error rate, or our hospitalization rate. Now you might think, what is the relevance of that to the consumer? Not as much perhaps to the consumer, but certainly to our referral sources. That's the world they live in. They're held to very high standards from outside payers, including the federal government, around outcomes, right? So if we're trying to position ourselves as a great referral partner with the hospital or the Medicare Home Health Agency or some of our national account payers, they want to know that we're tracking and trending quality outcomes just like they are. And so we do that today. We have lots of paper-based ways, fancy automated Excel spreadsheets that are great. But when we have mobile capacity with clinical documentation, that will just, make our outcomes tracking shine. With our national account program, we have many partners ranging from the skilled service arena to the private duty arena that choose us because of our high standards and our clinical expertise. A simple example would be in the worker compensation insurance arena. So again, here we have a large payer who is covering worker comp injuries, and if an employee gets injured, they need service. And so they're covered by worker comp insurance. And so we're in network with several large worker comp insurance companies who look for preferred partners to send these injured employees to for follow-up care. Now, sometimes that follow-up care might include a registered nurse. So for example, if you were badly burned at work, or if you had maybe a crushing injury of some type at work, and you need some sort of advanced wound care outside of your hospital experience, who's going to do that for you? Well, BrightStar can do that, and we're often selected by these worker comp insurance companies as a in-network provider because of our high standards. Not only because of our nursing expertise, but let's say because of that same crushing injury, you cannot do things like personal care or home care, the laundry, the cooking, housekeeping. You can't, for a short while, maybe dress yourself or bathe yourself because of the location of the injury. Well, again, we provide well-trained caregivers who have been credential verified, background checked, drug tested, been through very rigorous screening, but also, even more important, have been trained and competency tested by our registered nurse. Because BrightStar follows the high standards of BrightStar, but also the Joint Commission. The Joint Commission is the nation's largest and most well-known credentialing body in healthcare. Many of the nation's best hospitals are also accredited by the Joint Commission. BrightStar voluntarily seeks this accreditation, and I'll elaborate on that shortly, but one of the reasons we do is because of the high standards around employee testing and training. What do I mean by that? These worker comp insurers don't want to just use anybody as their service provider. They want a company that can provide individuals who know what they're doing and know how to do it. And BrightStar, again, because of our Joint Commission accreditation and our internal standards, does that. Every employee has to be trained and competency tested before they're sent out to perform direct care. And so one other unique attribute here is that our registered nurse is involved in that employee training and even competency testing. Now, what does that mean? If a direct care worker, a CNA for example, is doing transfer assistance, I'm helping as a CNA move someone from a bed to a chair. And to do that safely, I need to be properly trained so I don't hurt the client and I don't hurt myself as the worker, because either of those instances can result in horrific negative outcomes. I don't want the client to get hurt. I certainly don't want the employee to get hurt. In either instance, there could be implications, regulatory, financial, customer service, and reputation. And so the fact that BrightStar trains and competency tests every employee before we send them out to do direct care is a huge different and better story and a huge commitment to that high standard. And so it makes sense to our national account payers to use someone like BrightStar that they can really trust and rely on and execute their plan so that the employee who's been injured that they're paying for the care gets back to work as quickly as possible. So we make a compelling case for these national account payers, and of course that translates into great business for you as a franchisee.